How do you recognize distal muscle weakness symptoms? How can you tell if someone has distal muscle weakness? This condition mainly affects the muscles that are farthest from the center of the body, like those in the hands, feet, lower arms, and lower legs. One of the first signs is usually a noticeable weakness in these areas. This weakness can gradually worsen, making everyday tasks more challenging. For example, someone may struggle with fine motor tasks, like buttoning a shirt or walking steadily due to weakness in the foot muscles. You might also notice muscle wasting, which is when the muscles in the affected areas visibly decrease in size. People with distal muscle weakness often experience progressive difficulty with movements that involve their hands and feet. This could mean having trouble gripping objects or lifting their foot. In some cases, the weakness can extend to other muscle groups, including those used for speaking or swallowing. However, it is important to note that, unlike some other neuromuscular conditions, a person's intellect typically remains unaffected. Depending on the specific type of distal myopathy, there might be less common involvement of the heart or respiratory muscles. When patients report symptoms, they often mention a gradual onset of weakness without any sensory loss. This detail helps doctors differentiate distal myopathies from other conditions like peripheral neuropathies or motor neuron diseases. During a physical examination, a healthcare professional may find weakness and reduced muscle bulk in the distal limbs. There may also be limited range of motion or mobility restrictions. To confirm a diagnosis, several tests may be performed. Electromyography, or EMG, is one method used to determine if the weakness is due to muscle issues rather than nerve damage. Blood tests can measure creatine kinase levels, which may be elevated when muscle damage occurs. Muscle imaging, such as magnetic resonance imaging, can help identify patterns of muscle involvement. In some cases, a muscle biopsy may be necessary to detect specific changes, like increased connective tissue or fat infiltration. Recognizing the symptoms of distal muscle weakness involves observing the pattern of muscle involvement and noting the progressive nature of weakness in the distal muscles. It is also essential to rule out other potential causes through clinical and diagnostic testing. Early identification of these symptoms supports timely diagnosis of distal myopathies, which are a subgroup of muscular dystrophies. This early diagnosis can guide management and genetic counseling, providing individuals and families with the information they need to navigate their health journey. Always consult a healthcare professional for personalized medical advice and to discuss any concerns regarding muscle weakness symptoms.